Welcome to everyone joining us here at the FH Europe Foundation for this important webinar, the content of which was co-created with our rare disease patient ambassadors in the context of the Rare Disease Day campaign. My name is Jill Prava, and currently I'm the Rare Diseases Project Manager for FH Europe Foundation. And before we start this webinar, if we could just do some housekeeping as always. It's if you have questions for the webinar, please put them in the chat. In the Q&A. If you have, if you want to say hello to people, do that in the chat. Here we go. The webinar is being recorded, and the recording will be available on our YouTube channel, and we'll send it out to all participants after the event. So awareness around Rare Disease Day is always about shining a light on the issues affecting people with a rare disease, whatever that rare disease is. Things like equal access to care, to the workplace and to education, etc. So one overarching issue which affects everybody who's in a patient role really seeking care is communication. What, how, and when information is communicated can have a huge effect on the lives of those dealing with a rare disease and can profoundly affect their lives. So I'm pleased to say that we have had about 120 people register for this webinar, ranging from healthcare professionals, patients, carers, and from the research community, which I think indicates that this is a really important topic for everybody in all areas. So it's a huge topic. And so in this webinar, we'll only be able to scratch the surface, but what we're hoping to do in the time available. So in this webinar, we'll only be able to scratch the surface, but what we're hoping to do in the time available is illustrate the different experiences of the patients and carers here this evening in order to get us all thinking about the impact of communication or lack of, and also to give some tips and strategies for future communications to try and improve everybody's experience. I'm therefore delighted to introduce our panelists for this evening's webinar. We have Sherelle Licha from Lebanon, who was diagnosed with homozygous familial hypercholesterolemia, HoFH, as a baby. Maria Nassif, who is also from Lebanon, but is currently living in France, who was diagnosed with HoFH at age 6. Michelle Watts is from the USA. Her daughter Avery was diagnosed with HoFH when she was 6 years old. We have Finn Day-Lewis from the UK, who is parents to 3 boys, 2 of whom have FCS, and they were familial chylomicronemia syndrome. And one was diagnosed as a baby, and the other was diagnosed at the age of 6 at the same time. And myself, I'm a patient with FCS, and I was diagnosed at age 2, and I'll be sharing some of my experiences in this area as well. I'm also really pleased to introduce our final panelist, Natalia Vázquez from Argentina. Natalia is the founder and scientific director of, in English, Applied Psychology Foundation for People with Orphan Diseases, short as FHEF, who has done, I hope I pronounced that right, Natalia, who has done some research in the area of communication and will be sharing some of her findings with us later, and that's in the rare disease area. So for the purposes of this webinar, we're not intending to be disease specific, but if you have any questions as we go along, please put them in the Q&A, and I'll try and pick them up as we go along. So I'd like to start this important topic with the experiences of those who grew up with the rare disease. So Sherelle, if I can start with you, when did you become aware of the fact that you had HoFH? How was this communicated to, and what impact has this had on you, particularly in how you feel about your rare disease and how you manage it? If you could
Okay, so hello everyone. It's an honor to be among you today as we talk about this very important topic. By sharing my story, I hope to shed light on the power of clear, compassionate communication in rare diseases. So answering your questions, Jill, for me, HoFH isn't just a diagnosis. It's been a part of my life since I could remember. So growing up with this condition has shaped me in ways I never really imagined. So back then, my understanding of HoFH was very limited. And to tell you the truth, I personally wasn't really curious about it. I simply followed instructions, unaware of the reasons behind them. And I was doing what I was told to do, take medication, do the LDL apheresis, eat healthy, and avoid heavy exercise to prevent cardiovascular problems. But looking back, I realized that early and comprehensive communication could have made a significant difference in my life. Given my diagnosis at a young age, doctors often disregarded explaining the details of the condition to children. So it was essential for my mom to fully understand HoFH so she could help us navigate it at home. So due to the unclear information and the lack of proper guidance that was provided to her at that time, it was challenging for her to know what questions to ask and to be able also to help us understand it. So that has led to unintentional fear tactics to ensure that we as her children take our medication and do the treatment. So I found myself doing the treatments only driven by fear of potential complications rather than explaining or understanding why I am doing the treatment. And so I think this lack of understanding had a big impact on my mental health, and HoFH became a source of anxiety and fear, overshadowing many aspects of my life. So learning about HoFH hasn't been easy, and I only began to take an interest in understanding my condition in my late teens. Initially, I relied on information provided by healthcare providers, but sometimes healthcare providers, their knowledge was limited. So it wasn't until I took matters into my own hands, actively seeking information online and connecting with patient organizations like FH Europe, that I began to truly understand the details of HoFH. So this journey of self-discovery has positively influenced my relationship with my disease and my ability to self-manage. Through patient organizations and patient stories, I gained insights into aspects of my condition that I never truly knew existed. I found myself inspired by those stories and to ask more and advocate for myself and for the needs that for my condition. So communication isn't just about conveying information. It's about fostering empowerment, understanding, and also it's about community. So for patients, I think understanding their conditions and the reason behind their treatments and their lifestyle modifications helps ease the fear and uncertainty and empower them to take control over their health journey.
Brilliant. Thank you, Sherelle. So there's a lot there about actually being kind of taken sort of hand in hand as you grow up about, you know, what's appropriate and what things are, and actually explaining to you rather than just keeping you in the dark, as it were. Yeah. Okay. Maria, would you could you tell us a little bit about your experience and how things have been for you growing up living
Yes,
with
of course.
HoFH?
Yes, of course. First, hello everyone, and I'm glad I'm here to talk about the differences I had growing up with HoFH, with communication I had with healthcare systems between Lebanon and France. So I'm a patient. I can say I'm colleague to Sherelle. We were in the same health center, and we had same doctors and nurses take care of us. Knowledge and communication about HoFH was very limited with the doctor and the nurses. When I was young, I was taking my medicine. I was eating the food that my parents and my doctors told me to take to have. I went to the center where I will have the LDL apheresis. I have seen all of the people lying on bed connected to the machine. So I said, okay, it's a normal thing. I'm gonna do this as all people are doing. I started feeling not a normal kid when I went at school and people start to ask me what are the exanthemas on my body are. So that's when I figured, okay, I'm a sick person. I'm not like everyone else, and I wouldn't understand what it is. Growing up, I was in the shadow and I didn't understand anything about this. So I started telling people I eat lots of sugar or thing that I shouldn't eat. In late teens, when we started to be more or less independent, when like at the center, when we do the LDL apheresis, we have always the test before and after this session for blood LDL cholesterol levels. So that's where I started to know that there is cholesterol somewhere in my sickness, but I didn't understand quite exactly what it's about. In my 20s, when I started to go out with my friends, I want to feel normal like them. So I wanted to eat like them, and I didn't want to feel sick because being sick for me is like being a weak person. So I was like doing my own choices between what to eat, if I want or not take my medicine, but I would always do my apheresis. So I would have my own choices regarding what I want to do. And the level of the cholesterol was very high, and the doctor never warned us, neither alarmed us about being or having the high cholesterol level that we did. So I ended up at 24 having the open heart surgery. That's when I went to France because my brother was there at the time, and he told me the healthcare system over there is better. So I went to France. First thing they did to me is lots of screenings, images, blood tests, and stress tests. And that's where they came up at the end with 7 pages report about what I have in my body. And I've seen many doctors, everyone specialized in nephrologists, hyperlipidemias, endocrinologists. Everyone talked to me about this disease in a scientific way that I would understand what is it about exactly. Like, I don't have receptors in my body. It's a genetic disease. And that's where I knew that I shouldn't eat high cholesterol food. I have to take my medicine, and I have to do the apheresis. So that's where I knew exactly what I have to do and how to take care of my body to avoid later coincidences or accidents to happen like I had in Lebanon. And 2 years later, I got better results with the cholesterol level from the blood test that I do from the apheresis. So scientific knowledge is very important.
Sure. So it sounds again like the kind of lack of information made you go off into your own path about what might make it better and what might not, and that these paths weren't kind of particularly helpful really, and that actually being kind of walked through it and understanding much more clearly gave you a much better sense of how to look after yourself. Yeah.
Yes.
So I wanted to just spend a little bit of time talking about me, and I'm going to read this because otherwise I'll go on forever, actually, because this is a big topic for me. But I have FCS, and I was diagnosed when I was 2, but I don't remember very much with doctors or any negative things as a child with a doctor. So most of the information I got was from my mum. And she'd grown up in London during the Blitz, and would tell me, she'd kind of been through really hard times, and so she would tell me that there were children far worse off in the world than me, i.e. stop complaining, would tell me that I was the same as everyone else, which on one level I am completely, but on another level I'm completely not. And I know her intentions were good. She wanted me to be able to participate fully in my life, but it had the effect of making me feel shame when I struggled with doing what I needed to do to stay well. And I felt self-loathing when I didn't do the right things, and especially when I got very ill. And I kind of blamed myself really because I wasn't doing what I ought to do. We didn't know any others with the condition, and although my eldest brother has it, his manifestation of his symptoms is very different to mine, in fact. So I felt very isolated and very alone. And I could never be quite sure whether what I was experiencing was to do with having a rare condition, whether it was to do with being human, or whether it was to do with a perceived personality defect. And I sort of chose to sort of go with the personality defect kind of idea throughout my kind of, childhood and young adulthood, and kind of into my adulthood, really, for quite a long time. And I had a very low opinion of myself based around the fact that I couldn't keep myself well. And so it had a huge effect on my mental health, in fact. And managing these severe restrictions, which I do, I have to manage a very low-fat diet. They weren't acknowledged as particularly difficult. I don't ever remember anyone ever saying to me, that must be hard. And nobody tried to explore why I was finding it so hard. So even though I had kind of bad blood test results and things, that was a kind of, oh, we'll go away and do it better. But no sort of support about how I might do that better, or what was kind of getting in the way. And in fact, I went off and trained to be a counsellor myself, so that I could kind of understand it all a bit more and try and help myself. And also psychological support wasn't offered at that time, and there was no information anywhere from a patient perspective other than the bored facts of what you can and can't eat. So as I've alluded to, living with FCS requires accepting very many restrictions on having a normal life, making spontaneity very difficult, and often means I miss out on loads of things because they're too difficult to navigate. I'd have no enzyme to metabolize dietary fat, would have regular blood tests to check my triglyceride levels. Normal levels are under 2 mils, whereas mine were often in the 30s, 40s, sometimes higher. As I got older and I got more settled and essentially got married, actually, and my husband, who's a very good cook, started kind of feeding me, to be honest, I managed to bring my levels right down. And I was in my 40s when I saw a registrar who I hadn't met before, and who looked at my blood results and said to me, how do you manage to do this? This is so good. And I burst into tears because I'd never, ever, ever had any acknowledgement of how difficult it must be, and, how much work really I had to put into managing my health. And so the key things really that would have helped me to have a better psychological outlook, I think, would have been to have somebody talk to me about what I was going through, really, or to have some sense, really, or having thought a little bit to make the effort to think about the daily reality of what it was like for me to live my life, managing a severely restricted diet. And I think this is the same for any rare disease, or maybe any disease, actually, that actually you just want somebody to have a little thought about what the person in front of you is actually having to deal with on a daily basis, which, you're not having to kind of even consider yourself, maybe. Because we also have other stuff that goes wrong or goes right in our lives. It's not just the rare disease. I've had a number of different consultants with varying skills in the area. But I think all of this lack of communication and lack of kind of a lack of understanding that I felt really led me to set up the charity Action FCS, because I wanted to provide a place for other people to meet each other, who could actually talk to somebody else who really understood what it was like. And I think that's really kind of changed my life, actually, again, to be able to talk to others who know the situation, and then together we can find ways and strategies to kind of make things better for everybody. That was my story. But Michelle, as a carer, you come in from a different angle, really, because you were the parents, or you are the parents, you are the parents of Avery, and so were the parent whose child was diagnosed with a rare condition. And I wondered if you could tell us, or will you tell us, please, about your experience of communication around Avery's HoFH, and what its impact on you has been, and what, looking back, might have been done differently, do you think?
Absolutely. Thanks, Jill, for the introduction, and thank you, FH Europe, for having me from across the pond. I also prepared something to read because I felt like I don't want to leave anything out that's important. 9 years ago, my husband and I, along with our 3 children, crowded into a tiny hot doctor's office where we were told our daughter has a life-threatening rare disease, which at the time I couldn't even pronounce. The doctor talked to us for about 3 hours and explained exactly what kind of rare disease she had and how it affected her body. We learned she would need medications and invasive treatments, and in our daughter's case, has ended up needing 3 open heart surgeries to date. I honestly don't remember much about what exactly was said during those 3 hours, but I do remember the doctor telling us that our daughter was 1 in a million. I thought he was exaggerating for emphasis, but later learned he was very serious. I don't remember what I was thinking as we drove for 3 hours to the hospital where he was located that morning. I don't remember what it felt like when we were trying to find our way around the hospital to the cardiology department where our appointment was. What I remember is that it was in the middle of winter. It was very cold outside. It had recently snowed, and we were all wearing big winter coats. Of all things, that's what I remembered from that 3-hour conversation. When we walked into that doctor's office, we thought we had completely healthy children. Hearing that your daughter is essentially sick with a life-threatening disease just left me feeling shocked, numb, and in utter disbelief. I remember looking at my children sitting on the medical table in their winter coats and just thinking, I must be dreaming. This can't be our life. Our daughter looks perfectly fine. How can she have a life-threatening disease? There were so many questions that would later arise once we had the opportunity to go home and unpack everything we were told that day. But sitting in that office, I felt like I was outside myself. I couldn't think of questions to ask. I just felt numb. Our family's lives were forever changed that day, and one of the most memorable things I can remember is not what the doctor told us, but again, that it was a cold winter day. Getting life-changing news is difficult under the best circumstances. In our case, I went home and started Googling my daughter's disease. And as you can imagine, that didn't go well. Everything I was finding online made me almost hysterical with fear for my daughter's future. I don't know that there really is a good way of getting news like that. If I was a medical professional, I honestly don't know how I would break such serious news to that of my patients, knowing what they are being told is most likely not really being absorbed, because really, how does one absorb 3 hours of information in one sitting? I just know that there must be a better way to convey such news.
Thank you, Michelle. That's a very kind of recognizable issue, actually, about kind of just sitting there and everything being numb, because actually all you've heard is that your daughter's really ill, and then there's a lot of information come flying at you, which is really just hard to kind of yeah, as you say, accommodate. Yeah. Finn, how was your experience with your children when they were diagnosed? What do you say would be, you know, has been your experience? Sorry, I'm repeating myself. You're on mute, Finn.
Apologies, can you hear me now? Sorry. Hello, everyone. Yeah, so my initial experience was a little bit terrifying. It was our youngest boy, Carlo. He was 3 months old, and he'd become very ill. He started vomiting all his feeds. And so we took him to a local hospital, and he sort of went downhill really quickly. So we were obviously pretty scared anyway. And I think that initial experience was with the healthcare professionals didn't really help us, because they seemed quite scared as well themselves. They seemed like they didn't know, they couldn't work out what the problem was, and they were sort of talking to each other rather than to us, and sort of discussing possibilities that he may have this and he may have that, and you know, they were all pretty scary things, that we'd heard of, but obviously no one had any idea what he did have. I could see when they took a blood sample, I could see that his blood looked very unusual, and I could see that that made them sort of worried as well, which again, at that time, I think we thought, like most people, that sort of doctors knew everything, and we were sort of naive like that, and to see them a bit worried and a bit scared themselves made us more worried and more scared rather than putting us at ease. That local hospital, it felt like they couldn't wait to get rid of us, and that was pretty much what they did. They got a drip into him, they got him hydrated enough so that he wasn't, you know, we were no longer worried that he'd die sort of immediately. And then they got us in an ambulance and blues and twos to a hospital that had a big sort of specialist pediatric department that had lots of specialisms there. Once that had happened, things got a bit better. Their communication with us was much better. They did use, you know, you do learn a new language, I think, and you have to try to learn it pretty quickly. And they're using terms that we'd never heard of before, but they were at pains to explain things to us. And the whole journey through the boys' diagnosis was, it felt like it was a process that they'd done before, perhaps not with the same condition. It took 5 weeks in this hospital, with him staying in this hospital, for us to get diagnosis. And then it was explained to us that it was a genetic condition and that our other boys might have it as well, and they'd have a 1 in 4 chance of having it. We thought they wouldn't have it because they seemed well. However, when they took our middle boy's blood, I could see that it was the same as the younger boy's blood. You know, again, we just had to learn to live with this sort of condition, and we were transferred to another hospital, which was a pediatric specialist hospital in London again. And there it was a metabolic disease department, so it was metabolic medicine, so they really knew what they were talking about. And what they did that I thought was really helpful for us was that they offered, when Devon, who was the older boy, who was 6 at the time he was diagnosed, started to show sort of psychological issues with his condition and with the life that he was now having to lead, having led a sort of from a dietary point of view, a more normal life before. They offered us psychological support, which was really important. He, for example, was absolutely terrified of blood tests, so it was good for that. But also, like most young people, they don't want to be different. They don't want to be seen to be different from their peers, and that help was fantastic. So after a sort of initially, you know, that was a thing. There's a sort of was a sense of empathy, and also you felt like you knew that they knew the condition, and were able to explain it in a way that we could understand. They were also great, as Devon is now 23, so he's transitioned to adult services, and they made a point as the boys got older to start to talk more to them and less to us, which I think was really important, because, you know, that's a big jump for the patient and for parents or carers, because you feel like you're losing control of something that, you know, I suppose in any way, like when a child leaves in any way, it's difficult. But yeah, so from that point of view, it became a much better experience, the communication, having had a very rocky start.
Thank you, Finn. And I something that I picked up from your rocky start was that you know, the comment about you know, most people think doctors know what they're doing, and I think there's a real loss of innocence for people when they go into the rare disease area, about people don't know what's going on. You know, the doctors don't know what's happening, and so you're suddenly kind of not in this secure world now where there's a treatment and you'll be out of hospital anymore. It can be going on and on and on, and there's kind of constant having to manage, rather than it's, you know, normal illness is you get ill for 2 weeks and then you're okay again. This is an entirely different world, and I think that's a really quite a shocking world to walk into when you first, and I'm not sure that's kind of acknowledged sometimes, actually. But thank you for that. But actually, it was good to hear that you had such a good experience in the UK, because it seemed like everyone was talking to you as kind of as an equal and bringing you along with what they were doing, which made things much easier. So Natalia, if I can come to you now because you've done research in this area you work with a lot of different rare diseases, and I wonder if you could share some of the learnings that you've gathered through your insights into the work that you've been doing.
Yes, thank you. You can hear me all right, and you can
possible.
see my, okay, that presentation. Okay, thank you. So good afternoon to everybody, and thank you for being here today. I'm honored to have the opportunity to share with you some ideas about communication in rare disease. I'm a PhD in psychology, and I'm the founder and scientific director of FHEF. FHEF, as Jill said, is Applied Psychology Foundation for People with Orphan Disease. And I'm very happy to have my team present today with me. And I'm very grateful to Jill and Elsie for this opportunity. So this will be the most important topic that I will share with you, but feel free to email me. I would love to share ideas with you. And we need to say that rare disease, despite their individual rarity, collectively affect millions of families. And there are certain parallels of how patients and also caregivers perceive communication during diagnosis process, how they experience psychological impact, and the challenge in achieving effective self-management. We have listened something about the testimony that you share with us, and we think that effective communication is not just about delivering information, it's about fostering understanding, it's about empathy, and it's about support. So when we talk about communication, Waslawik, first action simple says, one cannot not communicate. This shows the inevitability of communications. We already listen how patients and caregivers experience communication process, and I want to share with you some ideas on what we have learned in these years with FHEF team. So, what to communicate? Well, the focus of communication in rare disease is the diagnosis and the risk of transmissions. And who have to communicate? Who have to participate in this communication process? We need to say that, of course, geneticians and genetic counselor, and also patients or caregivers. But we always say, don't go alone to medical consult. Ask a family member to go with you, because this will improve chances of remembering what is communicated in that consult. Asking questions may be more easier in that moment because we are full of emotions and we can feel accompanied. So when? Well, there are three important moments in genetic counselor consults. One important moment can be preconception consults, when we have a kid and we suspect something is going wrong. In that moment can be pediatric consult and also adult consult. Where to communicate? It's very important to look for a suitable, calm place with privacy. This is very important. It seems to be very, very, I don't know, maybe obvious thing, but it's very important to look for a very good place to prepare that situation with family. And where to communicate? We see that every family has the right to access to information that allows them to make the best decision about their condition, about the treatment, about how they can improve quality of life. And how? We think that there are three important things: to offer clear information, to check in for understanding, and provide opportunity to acknowledge feelings and that. Before somebody say about the important thing when there are adolescent consults, to give them some spaces, because it's very important for them to share what they think, what they are worried about. Another brief tip that we give every time we train doctors: we suggest that once the medical consultation is over, change the question, did you understand? Because probably most people say yes, but we know that that is not necessarily true. So we suggest changing the question for, when you get home and your family asks about what we have talked about, what you would say? It's just a little minutes, but I promise this will change communication process. So I want to share with you, these are findings from an ongoing research project involving healthcare professionals dedicated to rare disease. Several years ago, when we began working with patients, caregivers often say, "Who think of us?" This prompted us to design workshops for caregivers. However, we encounter a new demand. Physicians start echoing the same, "Who think of us?" This compels us to investigate the communication process from their perspective. And as you can see here, there are we select 4 answers for medical doctors that have a lot of experience with patients with rare disease. And from this answer, we can start thinking that part of communication challenge is not only related to clarity of information provided, but rather how physicians feel about what they are communicating. And of course, we ask caregivers of children with rare disease about their perception about communication process. And they mention feelings about fear, uncertainty, and the need to be here and to receive information that is true, but with hope, what we can do from now for the future. So to sum up, good communication skills are very essential for improving patient and caregiver empowerment. This is very related to health literacy, genetic literacy, and the opportunity for shared decision making. So, frequently, the anxiety of uncertainty is relieved when the diagnosis arrives. Knowing the diagnosis allows us to consult specialists who can give us treatment guidelines to achieve the better quality of life. Once a rare disease is present in the family, one cannot not manage. The only question is how. Lori is one of the biggest authors of this area, and she said that one cannot not manage. Self-management intervention aim to support patients as active patients in their treatment, dealing with physical and psychological consequences of a chronic disease and changes in lifestyle. At FHEF team, we have developed a specific psychoeducational support program for families with SMA in process of gene therapy, for families with XLH to increase well-being and self-management, and for young adults with MPS, that is another rare disease, to promote their independent living project. So just as Waslavic say, one cannot not communicate, and Lorik say one cannot not manage, to think about psychological impact, we propose these phrases, this expression, one cannot not feel. So talking about psychological adaptation, we think that psychological adaptation is a process that is individual, that is non-transferable, and is very necessary to achieve a good quality of life in the family. And these are, we call this like red flags, and I want this to take home this information, because there is not a thermometer for mental health, as, for example, you know that fever is a possible indication of an infection. So one tool that that really works very well with family is to identify red flags. And these red flags are the most common that we have observed in families with rare disease. And this indicates overlap that significantly affect quality of life. Some evidence about research. What we have learned about our studies. Well, one of our paper, it's about genetic literacy in caregivers. And we have learned that not all caregivers receiving genetic counseling reach adequate levels of genetic literacy. And this is very related to level of education. With a higher level of education, they can understand better things that are taught in the genetic consults. Another study conducted on adolescent patients from a genetic service revealed low levels of genetic literacy, particularly in tasks involving arithmetic, comprehension of important terms used in genetic councils. And talking about adolescents, and before Finiam, they say something about that, about transition. Adolescent is a critical phrase, and that's why we have published a consensus to how to promote good transitions between pediatric and adult care system. We also have studied quality of life in family with rare disease, and we especially have other papers about mental health issues in caregivers, and also we have studied the association with psychological adaptation. And I think this last one that we talk about the role of psychologists in dealing with people with treating families with rare disease is one of our most complete article when we talk about how we can be near family and how we can help with a psychological perspective. So we want also to share with you some other tools about how we can deal with emotions, and we can say that it's very important to do pleasant things that are possible in the moment, find hobbies that can recharge your battery, to practice self-empathy. Maybe you can think, what do you say to another person that is going through the same situation, and say the same to you. Learn to treat yourself in a kindly way. Find the best way to deal with emotional situations, to be prepared. Thinking about taking time for ourselves maybe can sound selfish, and a metaphor that we always use is, do you remember the oxygen mask on the plane? Well, the flight attendants clearly tell us that in the event of an emergency, before helping others, first we must put oxygen mask for us. This is a safety measure, not only in the plane, but a great strategy for a good quality of life in families with rare disease. We need to take oxygen for ourselves before we can help others. So let's practice a little of empathy. I want to share with you a very brief video.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
I don't know if you have listened that video before. I love we practice a lot in our workshop with families, because I think that is a very simple way to understand what is important to emphasize. Empathy communication is to be there, not to solve the problem, but to be there and to be grateful that somebody is sharing with you their feeling that sometimes and often they are not nice feeling, maybe afraid, maybe sad. But what really helps is connection, is to be there, is to listen, to say to somebody that is very important for you, that you have shared that with you. So to sum up, these are the most important message that I want you to take home, to take away home. One cannot not communicate. Communication is inevitable. One cannot not manage. We need to manage our treatment. And one cannot not feel. This process will be full of emotions. Maybe there are, as we shared before, the red flags. In that moment is maybe the best moment to go for a psychological consultation in order to be there for a very brief period in order to improve how to cope difficult situations. So this is FHEF. These are the most important pillars of FHEF. This is what we do. Our mission is to achieve an inclusive society where all people with rare disease can fully exercise their right and have the opportunity to improve their quality of life. We do research, we do training, and for physicians, medical doctors, and of course, we give psychological support in the assistant area. So here is our team. Of course, I don't work alone. This is our big team of therapists and also intern. Here is Victoria, that is the director of assistance. Is also Camila and Florencia present in the meeting. If you can go for all of our publication research, you can go there, you can scan, and you can go to my ResearchGate profile. There's all there. And I'm here for any question or doubts you can share with us. Here is my email, and thank you so much for this time.
Natalia, thank you. That was great. The empathy is, for me, is a very important thing. And certainly when we do the FCS 10-gram fat challenge and people actually kind of spend a day trying to eat like people with FCS do, the impact that has on us as patients, I think, is a kind of sense of somebody's walked in my shoes. And so it just actually does make life feel much easier, as well as people kind of understanding better what it is that we live with. So we'll hang on. If anyone has questions, we'll just hang on to those for just a brief moment, because I think the other interesting part or the important part of this whole thing about communication is how we communicate ourselves about our rare diseases. I think we'll probably find that we've got different ways of doing it, actually. So I think the answer to that is that there is no right or wrong way. It's just you have to find your way. So I thought it would be a useful exercise just to get everybody to say how we talk about our rare disease, so that others can kind of get some ideas maybe, or not. So I always communicate on a need to know basis, and so I don't tell everybody I've got FCS unless I need to tell them, and that's usually if they're going to feed me. And I'll go into some detail and I'll make it a medical kind of explanation, because otherwise I feel like I get treated as if I've got some kind of faddy diet, or I'm trying to slim, or I'm, or it's just not taken very seriously. So I go into a very I go into a very detailed kind of throwing in a few medical words to make it sound real. And then if I'm being catered for, I'll probably send out a sheet of dietary guidelines, which can be found on the charity that I set up, the Action FCS website. And I also, if I do that, send out a link. So if anyone wants to explore about the condition a bit more, that's available too. So I'll send them the link to the charity too. I never say it's an allergy, which some people do, because I then feel like people are watching me really closely to see how I'll react if I eat something. And I don't want to be watched. And so that's the way that I've managed to do it. And I kind of have the same kind of little bit that I say to most people, actually. It comes off pat now, but it does incorporate those kind of things. So Finn, you're a parent with FCS, or boys who have FCS. What are your principles when communicating about their condition?
Yeah, I think you sort of, I've developed a sort of a mantra, and it is usually an attempt to keep it simple, particularly if it's someone who just needs to know, wants to know why they can't eat something in particular or what have you. It's just, I've just tried to explain that they can't get the fat out of their blood, that they don't make the thing that we all make that gets the fat out of our blood. If you start to use medical terminology, I always find that it's a sort of it can turn into a much longer conversation than it needs to be. It can go wrong. I've had a particular instance with a football coach, one of the boys who I wasn't there, that he'd taken them out as a sort of celebration to get something to eat, and I think it was Carlo who said, well, I can have beans on toast, but the toast has to be dry, it can't have any butter on it. Then he started eating what they brought to him, and he said, oh, I think this has got butter on it. And the coach said, oh, what happens if you eat fat? And he said, well, I could die. But obviously he didn't actually mean he could die immediately, but this coach was absolutely terrified by this. So I think it's sort of just being clear, being plain, being simple, and issues with our most difficult issues were with schools, with especially school journeys, when they were going away with things, trying to get them to understand, the degree to which it was critical that they didn't go over the amount of fat they should have in their diet. But I think just not blinding people with science. If they show an interest, then yes, of course, start to go into the explanation, as you say that you do, using the medical terms and stuff. But then you find you need to explain each term as you go. So, it is complicated.
It is. Sherelle, how about you? What are your principles when you're communicating?
Well, for me, I actually grab any opportunity available for me to talk about my condition. I feel like if I talk about it, I'm more comfortable with it. So I advocate whenever possible for accurate understanding, because I often encounter, especially in casual conversations and in social settings, I encounter misunderstandings or dismissive responses, like, for example, oh, it's just cholesterol, right? Like, don't eat fried food, or just don't gain weight, or stuff like that. So I think this disregards the severity and the complexity of my condition. And I take this opportunity to educate them and to explain to them the reality of living with this condition, and that it's a rare genetic condition instead of just something related to food or to weight. So I take this opportunity to do that, and I also share with them the challenges associated with this, because I think I want them to feel, to have empathy. So I also share with them the challenges, not only the genetic or the scientific part of the condition. So yeah, like how you live day by day and how hard it is for some people. Like, we have some ambassadors have challenges in terms of accessing treatment, etc. So I do that.
Okay. Thank you, Sherelle. Maria, what are your principles communicating?
In my case, these questions arise when I have to answer the question why I have to be absent one day every 2 weeks, or why I can't eat whatever my friends want to, or when picking restaurants. So I start talking about having a high level of cholesterol in my body, and they tell me, yeah, but you are thin. And that's when I start to explain scientifically that, yeah, it's a genetic disease. I have this since I was young. It's something I have to live with to the rest of my life. It's not about what I eat. It's about what's happening within my body, within my genes, within my liver and everything. Getting very scientifically, whatever my doctors told me, I would share them to people who asked me about this. And I would, of course, talk about the, not only about the disease, but the medicine that I have to take, the apheresis that it exists, to a bit talk about awareness, making awareness to, in case this person in front of me knows someone who had the same case, maybe they would help them as well to understand what's happening to them and talk to them about, yeah, this disease, I have heard about it. There is this medicine, there is this treatment that we can do.
Thank you, Maria. And Michelle, lastly, how do you communicate Avery's rare disease?
Yes. So right after Avery was diagnosed, I actually created an online presence called Avery's Fight, where I have tried to educate myself the best I can. And then I regularly post on different social media sites to raise awareness and help others learn about Avery's diagnosis. I have found that in some cases it's better to hit them with the facts right up front. I recently had to take Avery to the ER for something unrelated. But we have a large presence of COVID in our community right now. So because of her additional heart disease, I didn't want her sitting surrounded by people with COVID. So as soon as we got to the ER, I talked to the triage nurse and I explained, this is the disease that she has. This is how it affects her. That she's already had 3 open heart surgeries, that she had a heart attack already. So once they hear all of that, they take it very seriously and they understand that I'm the expert in the room and they need to defer to me when making decisions. So I found that's the best way to attack this.
That's brilliant, Michelle. And that just brings me to the kind of thing that's, I think with you probably all share, that if somebody from a physician who is kind of ever says to me, I know all about your rare condition, I immediately think, not sure about that. So I really prefer it if a doctor says to me, please tell me about what your rare condition is, or please tell me about your life with your rare condition, and gives me, as you say, that authority to know about what I'm dealing with because I've lived with it a long time. So thank you so much, everyone, and I hope this has been interesting and useful for people who have been watching the webinar, and that we've at least scratched the surface really of what is a very complex and deep topic, and obviously it really does change the environment you're in, and interesting about how we all communicate about our rare diseases ourselves, and how comfortable we are about sharing stuff, and how important it is where we're at in our own journey really about wanting to communicate about what we say and how we say it. And as I said, there's no right or wrong, but there's what works for us and what we feel comfortable with. So I'm aware that we've really run out of time and that we won't have time to pick up any of the questions, but rest assured, anyone who's asked a question, I'm sure the panelists will be happy to respond to those questions, and so you will get a response to those. And I do apologize for not I didn't really want to curtail the discussion actually from the panelists. So yeah. So it leaves me to say thank you so much to everybody who's who's joined the webinar this evening and taken the time to join in this important conversation, but also to our panelists who've given their time to talk about their experience and hopefully help with kind of making people think about communication and how we do it. And this is for all of us. It's not, you know, there's no kind of particular pointing at anyone or any kind of area. I think it's about how we all communicate about rare disease and with each other. So it just leaves me to say thank you again to the panelists. Thank you so much. And then it's for me to say, in the context of Rare Disease Day, which this webinar is has been set up for, just to remind you, and if we could have there we go, an HoFH Awareness Day on the 4th of May on 2024. And this is exciting because this is the first time there'll ever been an awareness day, an HoFH Awareness Day celebrated anywhere in the world. And it's great because it's what's happened previously is that HoFH has been seen as kind of the kind of slightly overlooked bit of FH. In actual fact, the condition leaves people in a very different situation to having FH. It's different medications, different treatment options, different treatment regimes, different psychological effects. So that's a really exciting thing. So please look out for more information in the newsletter, and do please get involved when that process starts. And then finally, we have a couple of webinars coming up. So we're currently in LP(a) awareness at the moment, and we've got a webinar coming up on the 21st of March. And from today until the 20th of March, you can ask questions, I think, and register for the webinar. So do look out for that. And then we have the PERMED webinar, which is personalized medicine in FH. It's an introduction to innovative precision medicine research for FH, and that will be introducing what the work is happening in that area. So do please kind of sign up and register for both those webinars. But fundamentally, well, not fundamentally actually, but also excitingly, the HoFH Awareness Day, which is the first ever, and we want to make it as big and as good as we can. And very lastly, please can you, as we leave the webinar, please can you take the survey about attending our webinar and how you found it, and if you have anything to add or any comments. And I'll take this opportunity to say thank you very much again, and thank you for attending. Thank you, and goodbye.